We have 4 sponsor-only bill hearings. Hello, welcome to the Health and Government Operations Committee. Today we have 4 bill hearings that are sponsor-only. The first bill that we have today is Senate Bill 523, which is Senator Kagan, Health Occupations, Licenses, Certificates, and Registrations, Immigrants. I believe that Senator Kagan is ill, and we're going to have the House cross-file Delegate Peña-Melnyk present. Is that correct, Delegate Peña-Melnyk?
That is correct, Chairman.
Excellent. Well, you have 5 minutes. Welcome.
Thank you so much for having me. So good afternoon, Chairman and members of the committee. Thank you for allowing me to present Senate Bill 523 on behalf of Senator Kagan, who is not feeling well. As you surely know, we're suffering from a critical healthcare work shortage. The U.S. Bureau of Labor Statistics anticipates that 500,000 nurses will leave the profession this year, bringing the national total to 1.1 million vacancies. The lack of qualified healthcare workers have been exacerbated during the pandemic, putting our families and our neighbors at risk of receiving substandard care. 35% of the Maryland's acute care hospital have declared crisis standards due to severe staffing shortages and capacity overload. There are 3,900 nursing vacancies in state hospital, which is a 50% jump since last August. Maryland Hospital have paid an additional $435 million in contract labor cost over the pre-pandemic level, often being forced to hire traveling nurses and pay them double the average hourly cost of state nurses. This bill, as one of my colleagues on this committee likes to ask, what are we trying to do? So currently, in order to get licensed for the professional licensing board, the health professional licensing board, which we have 20, they actually ask on the application for your social security number. So not everyone has a social security number. And what this bill does is that we have Maryland citizens who have gone through the training and the schooling for nursing and other professions, but this here deals only with healthcare workers. And when they apply after they complete their education for a license, they can't get it because it requires a social security number. There are many ITIN holders, which is a number given by the federal government where you can work and contribute to the economy. And last year we had 89,000 people that paid $140 million with an ITIN number. So these people that complete their education and they apply for the professional licensing to be a nurse, they cannot get it because the application restricts it because it requires a social security number. So very simple. The bill fixes this by saying you can continue to request a social security number. And in addition, you can also request an ITIN number. So the application will have both numbers. This is really needed. And if you ask, is anyone else doing this? 14 other states, including New Jersey, California, and Illinois, have passed legislation regarding to expanding occupational licensure, regardless of immigration status. The fact is that we need these workers where they have gone to school, we have invested in them, and they now want to get licensed. I would ask respectfully that this committee return a favorable report on Senate Bill 523. Thank you, Madam Chairman.
Do we have questions from the committee? I see Delegate Kaiser.
Thank you, Madam Chair, and thank you, Madam Vice Chair, for being the House sponsor on this bill. My question in doing this, and I'm all in support of your bill. Should we be doing this for other licensed professions as well, or is this just a start?
Well, thank you for the question. The bill, as originally introduced, was actually broad, and it included architects and other professions which are in the same situation. However, in the spirit of compromise and in the spirit of the fact that we do have a shortage, we limited it just to healthcare workers.
Do you have any other questions from the committee on this bill? Delegate Morgan, go ahead.
Hey, thank you, Madam Chair. I want to make sure I understand the bill because I did log in a little bit late, and I apologize for that. Does the workers, the employees, still need to have a TIN number?
The employees will have to have an ITIN number. That is correct.
Okay, thank you.
My pleasure.
Delegate Krebs.
Thank you. And explain to us, to get an ITIN number, like what you have to do. Who was able to get it and how long does that last?
You have to apply, and a person who's undocumented needs to apply with the federal government. And it's a number that is used so that that individual can pay their taxes. And some of them work as independent contractors and have their own businesses with that number. So you apply for the federal government, and the federal government has their rules, and they decide who qualifies for that.
And is this bill for a certain period of time? Do they have a certain period of time that you expect them to get their social security number?
This bill basically says that if you have a social security number or ITIN, you can apply to get your license, which is, as you know, the last step in becoming a professional to be able to work. A lot of people that have an ITIN are people that are waiting to adjust their paperwork. For example, they're married to an American citizen and they're here legal, waiting to adjust it. There are also people that have what they call temporary protection status, which will be like people from Ukraine that were declared that they will have temporary protection status, or people from Haiti that were given protection for a certain number of time.
So, I mean, I guess there's two concerns. Number one is how long this can last for. I mean, can it just last forever? And number two, how do they make sure that they have equal training to what is required here for our boards?
So basically, the education that they have, if it's in the bill basically says that on page 5 of the bill, Senate Bill line 5, Health Occupations Board may not deny a license, certification, or registration to an immigrant if the individual otherwise meets all educational, training, or professional requirements for licensure, certification, or registration. So the boards actually establish their requirements, and that person will have to meet them. It does not change the merits of that board requirements for that profession.
I understand, but how do we do that with some of these countries where people are coming from? How do we make sure that the standards, like the educational requirements, the institutional requirements, how do we make sure those standards are to the level that we have them with all these boards? It just seems like it's a big ask.
Yes, because most of the people, if I'm not mistaken, these are people that have gone to school in Maryland schools, and have gone through the education requirement, stringent requirement. Most of our, 2-year colleges do a lot of these licensing, and our 4-year colleges as well. So these are Maryland residents that would apply for these licenses. This does not change at all the educational plan or the work course, anything like that. They must go through the course and graduate. And then the last step is where they apply for the licensing, and the boards have all their different requirements that must be met. This is just a small requirement where right now with an ITIN number, after they have graduated from a Maryland school in nursing, they can get their nursing profession because the board will not process the application because it requires a social security number.
Okay, so this only requires the people that have been trained here. Is that in some other
That
place?
is correct.
So let me
Okay.
interrupt and
Okay.
just make sure that, because I'm showing leeway because we're getting this bill late. But we do have the 1 question, 1 answer rule, and we will be discussing this bill in subcommittee immediately after. So there'll be plenty of time to talk through. I do see a lot of questions, so I want to make sure everybody gets a chance for their question at the public hearing. But we will be taking this up further, Delegate Krebs. My understanding of the bill is that it does in no way requires any changes to the educational requirements at all. There are
correct.
some boards that do accept international training. They've set those standards already. This does not change that in any way. The next up was Delegate Saab.
Thank you, Madam Chairman. So my question is a little bit different. So to follow up on Delegate Morgan's question, if you have an ITIN, that's not providing you a legal status to be working in the United States. So if we pass this bill, are the businesses that are hiring those workers or those licensees criminally opening themselves to fines and suspension, because it is still illegal to hire illegal aliens to work in the United States. So how would that work? I mean, I understand getting a license, but they still can't work because they're not legally here working, unless if the bill specifies that they have a work permit. I can see that. But how would it deal with the people that don't have a work permit? They are here undocumented or legally, whichever way you want to call it. How would that, under this bill, how would that work?
So thank you, Delegate Saab, for the question. So under the bill, a person basically the boards would have to accept a social security or ITIN number to give them the license. Then it does not deal at all with who can hire, but just to let you know that hospitals and other employers can sponsor people with an ITIN for them to eventually get their paperwork, and they offer them work. So they cannot even consider that if the person is not licensed, because the person needs to be licensed to be able to be considered for employment. But once the person has a license, then they will be able to get a hospital or an employer to sponsor them, and they're able to sponsor them, and the person can become a legal citizen and have their legal status.
Right. The problem with that is because of our broken immigration system, those sponsorship take forever. So I think with passing this, I mean, yes, you can have a license, but you can't work for a regular practice because they're not going to hire you if you don't have legal status. And for the hospitals to want to hire them, you know, the sponsorship part takes years and years and years before someone can even work legally. I mean, I understand the sponsorship part.
Actually,
of the hospitals.
Actually, I know certain people, they have gone through sponsorship, and they can work while they're being sponsored, because once you put in the paperwork, you do get a social security number, you do get a worker's permit. So that is not correct.
Right, but for the hospitals, but small businesses, it's very difficult for them to sponsor. So you still open up the door to have employers, you know, not being able to hire someone because of their status. And then some of them may not know that they're not here legally, and they expose themselves to being federally violating the federal law.
Not actually. Employers know that an ITIN number, they know the difference between an ITIN number and a social security number, and they know that the person is not here legally. But the objective of the bill is to grow that workforce, right, where we have a shortage, and to allow them to be licensed, so then they can be considered for an employer to go ahead and sponsor them if they need to. And I know several people, small employer, and I know big employers, they have done it. And it's very successful. Yes, Delegate Saab, it takes like 7 to 10 years for them to get it, but it's because they want to make sure that the person is actually going to work there, right? That they're doing it for the right reasons, but they're able to successfully process their paperwork.
Well,
Let me just,
we can talk about it in subcommittee. Thank you.
Thank you, Delegate Saab. And I'll just make sure you know, since we're getting this bill late, check the bill file. The Hospital Association, all the long-term care associations are supporting this bill because they do think that it will help. Let's go to Delegate Belcastro was next, followed by Delegate Hill. Delegate Belcastro.
Thank you so much, Madam Chair. And I just wanted to make one comment. My wife immigrated here legally, and while she was waiting for her permanent residency status, she was absolutely able to work and was hired by a small business. So just wanted to correct that record. But additionally, I've mentioned on here before that I'm a teacher in a school that has a large undocumented population, and I've had a number of students that have come to me with their dreams of being nurses and doctors. And as a teacher, we always tell them dream big. But what I'm hearing right now is that we're telling and preparing our students to move on into these healthcare fields. And I'm hearing that it's not possible for them to go into those jobs. Am I hearing that correctly?
That is correctly, because they're not able to get a license.
Huge problem. Thank you for bringing this bill forward.
My pleasure. Thank you.
Delegate Hill, do you still have a question?
Yeah. You had given most of my question, but let me so Delegate, I just want to be clear. We have a work shortage.
That
we
is
have
correct.
institutions that are saying that they want qualified professionals to fill those places, and we have qualified professionals who meet the licensure requirements of the boards, who have ways of accounting for people who both train here and are and come from foreign, who are immigrants, and for people who train in foreign institutions. Our licensing boards have ways of verifying their qualifications.
That's correct.
So what's happening is this bill is saying for those of you who meet all those qualifications, but you simply have an ITIN number instead of a social security number, we're saying that you can use that to get your licensure. Isn't that? What
That
we're
is correct. It
All right,
doesn't
thank you.
change the merits. Thank you.
doing? Thank you.
My
Excellent.
pleasure.
And I don't see any more questions from the committee. I did have one more question from the sponsor because I spoke with both the Hospital Association and the Board of Nursing about this yesterday. And they told me, in addition to the states that you mentioned, 14 states have updated their laws to modernize in this way or similar to this. But they also told me that the state of Texas, Florida, and Georgia is where a lot of Maryland's international nurses are currently coming from because they don't in any way check citizenship status. And so it's very efficient for a hospital in Maryland to bring nurses from the Philippines or from South Korea with licenses from those states and have them come and start working in Maryland and then go through the endorsement process here. So it's an inefficient bypass is what I understand that is currently being used. And my understanding is that this legislation would really help streamline this process for our hospitals and nursing homes. Is that correct, Delegate Peña-Melnick?
That is correct, Chairman. And in addition to that, if I may add, those other 14 states don't do it just for healthcare workers. They actually expanded to all the occupational licenses, like architects, engineers. But we're limiting it.
Excellent, thank you. I see no further questions, so that will conclude the hearing on Senate Bill 523. And as I mentioned to members of the Health Occupation Subcommittee, that will be on our agenda for the meeting after this full committee hearing.
Thank you so much.
Thank you. Senate Bill 460, I see Senator Augustine is here. I don't know if we do have our clock. Excellent. So welcome, Senator Augustine. We will be hearing Senate Bill 460, Health Insurance Coverage Information.
Thank you, Chair
ahead.
Kelly. Yeah, thank you. I'm sure you won't need the clock for me on this one. The Senate Bill 460 looked to create a consumer health access program for mental health and addiction care. The cross-file bill, House Bill 517, who was cross-filed by Delegate Lewis, she ably presented the bill previously. I just would let the committee know that we worked with stakeholders to really get this into a better shape. That bill, and that's how we come to you today. And I'm just really grateful that was already discussed in the subcommittee. And I really do look forward to working on this matter going forward. And so I'm just really grateful that I was get the opportunity to have this hearing, and happy to answer any questions that anyone might have. Thank you.
Wonderful. Thank you so much. Do we have questions for Senator Augustine from the committee? Seeing none, that concludes the hearing on Senate Bill 460. Thank you so much. Next, we have Senator Sidner. Do we have him here or someone from his office to present
Yes,
350?
you have Eugene Clark.
Oh, wonderful. Welcome. So we'll start the hearing then. Mr. Clark, you have 5 minutes if you'd like to take all 5 minutes to explain the bill, but you certainly do not need to, as we just saw from Senator Augustine. This is Senate Bill 350, Maryland Medical Assistance Program, Community Violence Prevention Services. Welcome.
Welcome. Thank you very much. And thank you, members of the committee. I do believe that this bill has already been heard by this committee as House Bill number HB 1005. And to that extent, then we're looking at this being, of course, the cross file of that particular bill. With that in mind, I would really open it up in terms of questions, in terms of folks who may want to know a little bit more about it.
Wonderful. Great testimony. Any questions from the committee members on this bill? I see no hands, so that concludes the hearing on Senate Bill 350. Thank you so much.
Thank you very much. Take care.
Excellent. And our final bill of the day is back to Senator Augustine, which is Senate Bill 590, Public Health Behavioral Risk Factor Surveillance System Requirements. Welcome back, Senator Augustine.
Thank you, Chair Kelly, and thank you again. I must say, this bill got caught up in rules. I did get it across in time for crossover, but somehow it got caught up in rules. So I'm really grateful that we can at least have this conversation about this bill. Senate Bill 590 is a public health bill that deals with the requirements for the behavioral risk surveillance system. I worked with Director Christy Peer and her team at the Center for Chronic Disease Prevention and Control on this legislation. Now, you know that this committee has led on addressing adverse childhood experiences and trauma-informed care. But the thing is that we need data. Last year, I had legislation to ensure longitudinal data that would come from the Youth Risk Behavioral Survey. Now, that went to, because it was done in schools, it went to Ways and Means, so you all did not hear that legislation, but this is a follow-on to that. So Senate Bill 590 requires the Maryland Department of Health, beginning in 2023 and every 3 years thereafter, in which the department conducts a survey as part of the Behavioral Risk Factor Surveillance System, to include the U.S. Center on Disease Control and Prevention module on adverse childhood experiences in at least one version of the survey. Beginning in 2023, if MDH conducts a survey as part of that survey, they must conduct sampling for the survey in a manner designed to ensure that counties in which the population is statistically higher risk for adverse health outcomes are oversampled. If MDH includes a module on ACEs as part of this survey, MDH must post a state and county level data summary and trends report on all data related to ACEs or positive childhood experiences within 8 months after receiving data from the CDC. In order for us to be able to really look to reduce ACEs and to work on that, we've got to be able to measure it. That's what this is about. It's about making sure that we have great longitudinal data. And I would just ask for a favorable report. Thank you.
Excellent. Thank you so much. Do we have questions for Senator Augustine on this bill? Giving y'all a second to raise your hands. I see no questions. So with that, it concludes the hearing on Senate Bill 590. Thank you so much.
Thank you.
So that was our last bill for the day. So that's also going to conclude this meeting of Health and Government Operations Committee. I will remind the members that we have 2 subcommittees that are meeting this afternoon and then a voting session at 5 p.m. With that, the meeting is adjourned. The Health Occupations Subcommittee is meeting immediately after this. So let's give ourselves 10 minutes. People can take a break, hit the restroom. That will be 1:35. We'll start.